Hello, my name is Trina Ganguly, and the date today is October 18th, 2022. Today I'll be discussing the sheep heart dissection for the lab portion of our anatomy class. And so here I have the heart. This is the, here's the anterior surface right this side, and this is the posterior surface over here. And this is a kind of like round view of the heart over here. And so on this side over here, this diagonal divide going down here, this is the intraventricular septum. This is what separates the right atrium from the right ventricles from the left ventricles, and it is the triangular wall of cardiac tissue. This also comprises of muscular and membranous tissue within the heart. And the left and right ventricles are known as the lower chambers of the heart. And so with the difference between the right and the left ventricles over here, we can see this is the right auricle over here, and over here is the left the left auricle on this side over here. And this whole cavity would be covered in something known as the epicardium, which is the outermost layer of the heart, and it is also known as the visceral pericardium. And this epicardium is the inside layer of the serous membrane that protects the heart within your chest. And these little wrinkles on the surface over here are known as the coronary grooves. That is where the coronary arteries would be going around the heart, which are the coronary blood vessels and veins, which help supply the heart with nutrients and oxygen to keep the heart going and pumping and beating. And so now we will look into the right ventricle a little bit. So it's a little bit difficult to see because of the way it is cut. So here is the left ventricle over here. So that is the left ventricle in there. And so when blood enters your heart from the rest of your body, it first enters the right atrium, and the right atrium is blocked by the tricuspid valve, and the right atrium or the right valve, and so it is a unilateral flow that is going on right there. Or not the right valve, sorry, the right ventricle. The tricuspid valve in the right ventricle is what is blocking the right atrium, and it is through there where there's unilateral blood flow. And then the blood goes down through the right ventricle, and then it comes back up through the right ventricle to go up to through the pulmonic valve into the pulmonary arteries, which then lead into the lungs, which is where the blood then gets oxygenated and then comes back around the heart to the and so then the blood comes back into your heart into the left ventricle, which I will show right here. So this is the left ventricle. So I opened it up a little bit more to give some easier access towards seeing what the inside of the heart looks like. So right here, so this is the left side over here. And so when the blood comes back through to the left side, it comes in through the superior and inferior vena cava veins. When you're looking into the left atrium, the blood first comes in through the left atrium at the top over here, and this white flap over here that is known as the and so that white area is known as the mitral valve, which can also be known as the bicuspid valve. And so that blocks off the right atrium from the right ventricle. And so the web-like structure in there, the tendinous structure which keeps up the valve, is known as the chordae tendineae, and that is attached to the papillary muscle. And that's the papillary muscle of your heart. And the papillary muscle is also part of the inner part of your heart, which is the inner layer, which is also known as the endocardium. And the endocardium provides protection towards the valves in the heart's inner chambers. So this thick layer of muscle right here is known as the myocardium. So this is the thickest layer of muscle. And it is the parts in between the endocardium and the epicardium. And the myocardium is known to be where the cardiac muscles all are. And so back to the blood flow process. So from the left ventricle, the blood then gets pumped up through to the aortic valve. And as it goes through the aortic valve up towards, then it goes towards the aorta of the heart. And so the aorta is this little tube right here at the top, and that then produces or distributes blood towards the rest of your body, which then helps keep your body blood flow going and pumping.